Have you ever wondered how music can have such an effect on our mental health? I'm Rosemary Golding, a senior lecturer in music at the Open University and a member of the Health and the Arts Research Group. My research focuses on the intersections between music and health, particularly mental health, in 19th century Britain. Often my historical research has interesting parallels with the present day. 19th century mental health care was the age of the asylum, large institutions that could cater for hundreds of patients, often in poor conditions. Asylum officers quickly realised that patients needed to be kept busy, and music formed an effective and efficient way of achieving this through dances, concerts, and individuals playing instruments in the wards or workrooms. I've thought about 4 key ways in which music was effective. First, events involving music offered one of the few opportunities for patients to meet together in a social environment, particularly for men and women patients to meet. Sharing the experience of music together was an effective way of patients feeling part of a larger community. Second, music also spoke to memory and connection. There are several anecdotes in the records of patients who recovered after hearing music, particularly songs connected with their heritage or childhood. Third, music gave opportunities for patients to develop creativity and individual expression or agency, in some cases being able to choose repertoire and perform in a band or a choir. Finally, at the same time, musical events, such as dances or concerts, were usually carefully structured, so patients knew what was expected of them and how to behave. They mirrored the experiences patients had in their day-to-day lives outside the asylum. One asylum manager commented that these kinds of events help patients to develop self-control. At the time, this was considered essential for patients recovering from mental illness. So by the end of the 19th century, these influences were widely recognised, and it was common for asylums in Britain and elsewhere to have their own band and choir, catering for dances, concerts, and religious services. And so the benefits of music, which we see today in community choirs, healthcare settings, and maybe even in our own musical experiences, can be traced right back to some 19th century ideas and practices.